2 weeks, the medical device tax has been used as a pawn in the shutdown and debt ceiling negotiations, but few people really know what it does or how it affects you. So we decided to take a look at what the medical device tax means for Greater Lafayette. The medical device tax is a 2.3% tax on the price of every medical device sold in the United States. That's 2.3% on everything from pacemakers and artificial hips to CAT scans and defibrillators. The tax started January 1st, 2013, and will eventually contribute $30 billion to help pay for the Affordable Care Act. Almost 4 years after it was made law, the tax has become a popular talking point with politicians. Speaker of the House John Boehner has been a major supporter of a repeal, and just this week, Governor Mike Pence was making his case at a medical device facility in Indianapolis.
Repealing the medical device tax is authentic common ground in Washington, D.C.
Indiana has some skin in the game, with the fifth largest medical device industry in the country, according to recent estimates. Cook Biotech is based in the Purdue Research Park in West Lafayette. Its 160 employees make a so-called artificial skin that's used on burn victims and hernia patients. Mark Bleier is the president of Cook Biotech. He says this tax is an unwelcome cost to an already long and expensive process.
It takes years to get a medical device to the market. It takes a lot of testing, a lot of regulatory clearances. So by the time you get a device to the market, you've already spent a tremendous amount of money.
The manufacturers could potentially pass increased costs to supply companies, which could then pass them along to hospitals and ultimately the patients. Hospitals generally buy medical devices from supply companies that fix prices in a contract. CEO of St. Elizabeth Regional Hospitals Terry Wilson has yet to see a large price increase, but the next contract could be priced differently.
We fear that that will be passed along in pricing at a time when we are being paid less.
Though a repeal has some bipartisan support, proponents of the tax say it would cost American taxpayers $30 billion.